believe everyone can see my screen. So I'm really excited to share my talk with everyone today. So about the Pathverse platform. This is something that we developed during COVID. We started in the beginning, and now we just finally launched, and we're very excited to share this research tool with everyone here. So my talk will divide up into 3 different sections. The first, I will highlight the opportunities and challenges in promoting physical activity and healthy living using mobile health technology. And this will set kind of the background for what we're talking about today. And then I will share the purpose and how we developed the Pathverse platform. And the overall goal of this platform is to accelerate mHealth research and knowledge translation. And the third and last point of today's talk, I would just highlight some of the use cases of the Pathverse platform, where one of my graduate students has recently finished a feasibility study looking at heart health and using the Pathverse platform. So I think everyone here probably already knows that a healthy lifestyle and regular physical activity is important. And as we can see from this diagram, regular physical activity of 150 minutes of moderate to vigorous physical activity minutes can reduce cardiovascular disease up to 35%, can reduce the risk of dementia, can reduce the risk of colon cancer. But one of the challenges that we see with physical activity is how do we actively promote physical activity and deliver to people and needs? And how do we deliver personalized physical activity interventions for those that are needed? And so this is where mHealth technology comes in play. And when I say mHealth is a field within digital health that's able to provide healthcare support and delivery and intervention using smartphones, tablets, and wearables. And I think throughout the COVID period, we really seeing kind of the virtual care come in play. And I really think that this is probably going to stay, or at least a version of it, post-COVID. And I think if you look at the overall market size in terms of mHealth, there's a lot of focus around lifestyle, fitness, nutrition, disease management, and that holds about 50% of the total market. So there's tremendous interest in how do we use mHealth technology to deliver these type of interventions. So there are certain opportunities with mHealth, and I'll highlight 3 main ones. One is probably most of you are already aware, is the ability to scale and reach large number of people. With what the data that we have seen with COVID, during the COVID phase, even though a lot of people physical activity level decreased, a lot of individuals are transitioning and seeking these online and virtual care interventions. And the second is the ability for mHealth intervention to be personalized, meaning that we can use the data collected to tailor that to individual needs. And last is the potential for cost saving, meaning that a lot of prevention, hopefully with prevention, we can decrease the cost care needed for chronic disease or later on. So when we talk about mHealth intervention, there are various different types of interventions. And sometimes we kind of group everything in one, but I just want to highlight there are differences. So one type of intervention is what I call here kind of the self-guided. And these are some of the interventions that we developed in lab and we're still testing. One of them is Draco, this cute little dragon that you see here. The idea of this game designed for kids is that in order to keep the little dragon healthy, you need to exercise with it. We're currently just evaluating the effectiveness of this intervention. And then the other type of digital health intervention, you can think of as more of a hybrid approach where there is a human interacting along with some self-guided material. And one of our programs we're evaluating called Generation Health, which is a 10-week family-based childhood obesity management intervention. And during COVID, we were able to adapt and move completely online. So we have now multiple versions of this program. And thanks to UVic's and COVID funds, we're able to enroll about 60 families into this particular program. So as you can see, there are various different types of digital health interventions. But one of the challenges facing these type of intervention is that there's the effectiveness of these intervention varies significantly. This is a meta-analysis. You can see on the bottom here that there are some interventions favors the intervention, and then some are not. But overall, there is a small to moderate effect size in terms of favoring digital health intervention. But one of the challenges is how do we figure out the necessary behavior change techniques in these interventions so that we can make these programs more effective. And the second challenge is associated with this mHealth technology is in public engagement. A lot of times what we think is that when we build these apps, people will come. But in fact, this is always not the case. It's very important to involve the public, co-design with the public and your end users in order to make the most effect. And the last here, as you can see, one of the challenges for designing these mHealth intervention is the cost and resources required. It's averages about 100 to 200K to develop and deploy one of these mHealth apps. And even though there are great advantages and opportunities associated with this technology, but as you can see from this, there are also a lot of challenges associated with it, from cost to figuring out how do we best design these interventions so we need rapidly prototype, as well as public engagement. So with these challenges in mind, my team here at UVic, we came up with a platform called Pathverse. And our goal of this platform is essentially to tackle these three challenges so it makes it easier for researchers to conduct mHealth research, but also become a central hub where participants can access some of these interventions and become part of the research process. So we designed this Pathverse program with three principles in mind. One is the ability to rapidly prototype and evaluate mHealth interventions. And as you can see here, the amount of apps that actually make it to the scale up and implementation actually is quite few compared to the ones in prototype. So this is why this is very important to have a tool where it's a very cost-effective tool for researchers to rapidly prototype. And second is that we want to make sure that this can become a tool that researchers can collaborate with participants to conduct and collaborate and figure out how do we best design these programs so there's higher uptake afterwards. And the third here is we want this platform to be cost-saving and time-saving in terms of development. So with these in mind, how does this work? How did we design this Pathverse platform? Well, in a very big scale, big picture, you have a research portal that enables researchers to go into a web interface to design these types of any types of mobile health interventions. So we want to make sure this platform is no code or low code, meaning that it doesn't require any software programming to develop it. And then once you develop this, you should be able to deploy the app right away. And then the participants will be able to download this app called Pathverse. And within this app, there are various different apps within. So it's kind of like an app within an app store. It's that kind of inception. So the name Pathverse, meaning that path to various different verse. And then you can obviously, if you're interested, you can go to the app store and download, and here's a username and password. You can see some of the designs we came up with. So we started this in 2019, and what we did first is gather user requirement. And the user requirement, we interviewed a lot of researchers to figure out how do we want to design this. I think one of the biggest things, the two biggest things that came up is compatibility, meaning that it should be compatible with various different iOS and Android phones. And then the second is modular design, meaning that researchers want to be able to pick the features they want within the app. So maybe one researchers want to self-monitoring tool, whereas the other researcher maybe want a chat feature, but without a self-monitoring tool. So then we can pick and choose these type of features. We did beta testing, and we went to work in 2020, and then we just launched officially in September 1st, so a few months ago. So this is what the researcher portal looks like when you're designing the app. And as you can see, in order to create content in the app, really it's about just filling in text boxes. Researchers are able to insert videos, insert text, insert questionnaires, any type of media content you can think of, and you should be able to insert. And then you're able to then kind of drag and drop in terms of the order you want to display the various different types of content. Now, once you have designed this, participants then will be able to download the Pathverse app and access the content you have created. But the content could be anything from text, videos, to even surveys. So we're still trying to figure out the various use cases that we are using. So right now we're mostly using as an intervention-based program. So we'll give participants this app for 8 weeks and we'll measure pre-post intervention. We're also exploring various other options such as daily diaries types of studies. One of the really amazing features that we embedded is downloading wearable data. So I think a lot of researchers have trouble accessing these type of data without you have to use an API. So this kind of creates a very easy to use tool for researchers if you want to download data, but for participants, it's also very easy to also upload their data in a secure way for researchers to access. So the last part, I want to discuss some of the use cases for the Pathverse platform. So when you log into the platform, as you can see on the app itself, there's various different types of program the user is able to access depending on their enrollment. One of this program that we have currently finished developing and testing is called the Heart Health Program. It's an 8-week exercise program aimed to prevent hypertension. And the idea of this program is we'll introduce users a weekly self-guided module. Within these modules, we will present with various different goals, self-tracking techniques, healthy living, and behavior change techniques associated with these modules, along with automated reminder. And what we're seeing with this combined, so we're testing this heart health along with some types of financial incentives, we're able to see that there is a small to moderate effect in terms of increasing physical activity levels. We're hoping to testing this out with larger population groups in the future. So if you're interested, feel free to send us an email. So once you log into the app right now, we have a couple different programs available. So hopefully we can get the public involved, as well as get the researcher involved to figure out kind of the use cases. So in conclusion, to sum it up, so Pathverse we developed, the goal is to use this platform to accelerate mobile health intervention research, as well as promote novel translation. For researchers, we hope that this enable researchers to develop these mHealth interventions without any software coding. So hopefully that can decrease the resources required. And for participants, hopefully this becomes a central hub where participants can access and participate in various different types of research studies, and obviously access the evidence-based health programs that has been shown to be effective. So if you're interested in participating or looking at the app, here's the link to it. And I just want to say thank you to my team and my funding agency for making this happen.